All right, all right. Good morning to you listeners here of Vitality Now. It's Dr. Brian Prax, and once again, my lovely sidekick, Dr. Jennifer, is not with us today. But we have the lovely Daria Brezinski and talking with us today on holistic health. Well, let me give you a little rundown of who she is. So Dr. Daria has degrees in education and psychology, and doctor's been working 30 or more years with people, individuals and autistic children. Those are adults and children.
Children and adults,
So
yes.
welcome to the show, Dr. Daria.
Thank you so much.
So what is this holistic health that we were talking about here before we started the show?
So holistic health is, sometimes I think it has a bad name these days because the medical profession, looks at segmented parts of the, we have psychiatrists who look at the mental and emotional, we have physicians who look at the physiological, and holistic is taking the whole person and looking at the whole person. And the problem with traditional medicine or psychology is the fact that we really don't have the time. If you're in a 50-minute period in an office, it's impossible to do observation and, find out everything that's happening to the person. And so I do concierge work. I go to visit people in their homes. I observe them. I observe children in relationship to their parents, to their families, to their siblings, in order to get a whole picture of what's really going on. Because my personal premise is that people are missing skills. From the time they're born, they miss skills. And as those skills, and lots of people, we just heard somebody earlier talk about coping skills. Coping skills are not real skills. They're Band-Aids.
Yes.
And so what we need to do is to find out what those skills are that people have missed. When you've missed a skill, then it builds anxiety, frustration, and on as the years go by. A lot of times I see young people, their first year of college, for example, their freshman or sophomore years of college. They've been straight A students, valedictorians, and all of a sudden they're falling apart because even though they may have an intellect, all along they had coping skills and they really didn't have the appropriate kinds of skills to deal with being independent. And so what happens is, they end up falling apart because they really haven't developed communication skills, listening skills, interpersonal skills, whatever it is. So those are the kinds of things we call soft skills.
I want to just rewind a little bit there, and I got to say, first off, we have just graduated 2 high schoolers and an 8th grader, and that story, I don't know if you were directing it to me because you know that, but that story has got me a little anxious, so maybe I have to work on getting rid of those coping skills as well. But having two of our kids going into college next year, this is really important for us. But I wanted to rewind a little further. You said, and people who are missing skills can wind up with things like anxiety, depression, and so forth. And maybe I can add some of those and so forth, and maybe even paint a picture. So and so forth could be things like digestive issues, because when you got anxiety, a lot of times we ball up on the inside and we don't digest our food well. So from the medical or the health care perspective, if you want to put a diagnosis, people could get things like acid reflux, and that could come from or be a significant part of anxiety or depression. Well, what happens, Doc, if somebody has digestive issues like acid reflux? What do people do? They don't go to you. They don't look at their coping mechanisms. They don't look at the cause of the cause, which may be anxiety, which the cause of that cause might be missing skills. They go to the doctor. Or probably before that, they go to CVS and they go to other places and they want to self-medicate the symptoms. So then they're taking Prilosec or they're taking something from the drugstore to subdue their symptoms.
The quick fix.
The Band-Aid, which then all of those medications have a whole list of their own side effects. So then that one might cause a side effect of additional tension or difficulty sleeping or whatever the case, or maybe higher blood pressure. So then, you got to go to the doctor. Well, these things compound over years. It may not be right away.
Well, I was just telling you that I had a recent situation. So I have had chronic pain in my shoulder. I've had stomach issues.
Right.
Sometimes I have inability to sleep.
Mm-hmm.
And I never put all these things together, but in the last year, I've had trouble with a swollen sinus on one side of my face.
Mm-hmm.
And my dentist said it had something to do with the tooth. Well, we tried everything working on this tooth, and nothing worked. I really wanted to keep my tooth.
Yeah.
I mean, we really want to keep our teeth, especially at this stage of life.
Yes.
Well, it ended up having to be pulled, and when he pulled it out, it turned out that the root had a fungus on it.
Mm-mm.
The fungus spread to my bone,
Yes.
spread to my sinus, and was throughout my whole entire system. It took him more time to scrape off the bone and deal with the sinus than it did to actually pull the tooth. Within 24 hours,
Yeah.
my 10-year chronic shoulder pain went away, my stomach calmed down, and I slept and have been sleeping ever
Oh
since.
my gosh.
So this is the interconnectedness I'm talking
Yeah.
about in terms of holistic health. How would I have ever associated my tooth with my shoulder with the sleeping pain? I mean,
Right.
I would never. And this all goes back to Descartes. I mean, a long time ago, we were taught that we separate the mind from the body, and we teach in school from the neck up. We don't teach about the whole body, and in terms of our education
Yeah.
as well. So people don't make those connections. And that's what holistic health is
Yeah.
all about,
Yeah.
making the connections, observing the body, trying out different things instead of the quick fix,
Yeah.
which is what you're talking about in terms of the prescription drugs.
You know what's amazing, as a chiropractor, we are holistic as well. And it's funny because it's not really funny, but we're so ostracized, where maybe the physical therapist or others are taught things from the neck down, and you're taught from the neck up. And we even have a little saying in chiropractic that sometimes people need a checkup from the neck up. Where what you were talking about there with this fungal thing, that can create obvious problems from your immune system, but how it affects the sinuses, and then it's radiating to the shoulder. And we can draw direct connections, physical connections, and get some ahas from that. But what does it even do on other layers of healing? What did that do? I'm just thinking.
I forgot to mention, before
Yeah.
I got the tooth pulled,
Mhm.
I got poison oak for the first time in my life, and it
Okay.
told me there's something wrong with my immune system. And
Right.
it was all interconnected, every
Right.
single thing.
Yeah.
But when it comes to people's, when we were talking about stress and anxiety and those things, if you think about, I don't have communication skills, I don't have listening skills, so I can't express to you how I feel. So what is my first reaction? I get frustrated, I get upset, I might walk away, I might start getting temper tantrums. So it all comes down to the inability to be able to communicate.
Right.
One of the things I teach parents constantly are communication skills.
Mhm.
Listen to your child.
Okay.
Don't advise, don't yell, listen. And the only way to do that, to be able to do that, is I walk around with them and I
Yeah.
demonstrate to them, and this is how we do it. So if you want to change your behavior, instead of being negative about it, give them the positive of it and keep reinforcing the positive,
Yeah.
and eventually they will move towards that.
Right. Wow, that kind of tying in with what you said earlier, that's a concierge sort of philosophy. And that's what we're seeing in the field of healthcare, even with my practice and a couple, maybe a handful of local and other doctors medical doctors who are doing this level of service. But I know doctors who come out thinking that I'm going to serve as many people, and they come out with the right intention, but their intention is, I'm going to serve as many people as I can, and we're going to do that, utilizing their insurance and this, that, and the other. But the insurance carriers aren't really paying for this type of, we could call it holistic healthcare, Dr. Daria, but I would call it healthcare. What I talk about with my patients all the time, they're like, what do you mean my insurance doesn't cover this? And how come it doesn't cover all of that? And the reality is, it doesn't cover health care. It's a misnomer. Your
Correct,
Anthem,
correct.
your Aetna, your Medicare, all of these are really sick care insurance. They're labeled as health care, but they're really sick care. They don't pay for that type of care. And I don't mean to step on your shoes, but does insurance cover this type of health care?
No,
It
And
doesn't.
so the whole key is preventative care,
Mm-hmm.
and insurance companies don't deal in
They
prevention.
do not.
They deal with after the fact.
And it's good to have that there. We need to have that. So, like,
But for emergencies.
exactly, that's
not
what I was
for
going to say.
every little thing that happens
It's
to you.
emergency care, it's catastrophic care, it's disease care, it's sick care, and people constantly come into my office. They're like, "How come they're not going to pay for you to fix me?" You know, I mean, I like we were talking with a different doctor, Dr. Bush, earlier in an earlier segment, and he's able to, and we are as well, reversing diabetes, reversing
yep,
obesity, and it happens just like that.
Yep.
But insurance, amazingly enough, doesn't cover any of that.
Right.
It doesn't cover him to sit there, or me, with my patients, to sit there for 45 minutes and going over exactly what you're eating, or even in your case, what you're thinking, or how you are missing skills. It's not going to cover those things, which one could argue could save the insurance carriers gazillions of dollars.
Exactly.
Amazingly enough, it doesn't cover that at all. Hey, if you're just joining us, this is Vitality Now. I'm Dr. Brian Prax, and today we're here with Dr. Daria Brezinski. She has degrees in education and psychology. She's been working in the Charlottesville and other areas for 30 or more years with people, helping people with autism, children and adults, but other conditions as well. And today we're talking about holistic healthcare, and I know it's spelled with an H, but couldn't it also be spelled with a W in between? Because you said before it's all about
but the
whole
the
body.
HOL is holy.
It's holy.
That's where it came from.
Is
holy.
that right?
And
Is that right?
because
Okay.
it was all about the sacredness
Okay.
of the body, and it's something when you have the kind of mechanical care we get in terms of our health these days, or not health.
Right.
It's more mechanical than it is anything else.
Mhm.
And so I think the precipitators of the holistic movement wanted to look at the body as a holy temple of,
Right.
of the energy of the universe coming through us, and
Mhm.
that's how it was created. But yes, it could be WHO.
It could be. Yeah, because that might turn off some people as well.
Exactly.
But yeah, when we talk about the holy perspective, I totally get that from an energetic
Well, think
flow.
about this. If you're at work and your child is in the emergency room of the hospital,
Mhm.
can you function at work? Of course
no, I need
not.
to be at the ER.
Yeah, exactly. Your body, your emotions, everything is over there. It's not
Mhm.
sitting in that boardroom. And
Yeah.
so our emotions are the drivers of our body.
Mhm.
We segment everything in this, patriarchal climate that we're
Yeah.
in. Everything has to be compartmentalized,
True.
segmented,
Yeah.
in a department here, there, and
Mhm.
everywhere.
Special
and so
diagnosis for every little
exactly,
condition.
and we've lost the capacity to be able to put things. Well, even our educational system is the same way. We have all these separate, curriculums that we teach children, but nobody ever teaches them to put it together. So magically, when they graduate from high school, they're supposed to be putting everything together again. So
I got to put a plug in for the Charlottesville Waldorf School,
Okay.
the whole Waldorf thing, because that's exactly what they do. And hey, our kids went there, and we just graduated somebody last week, so we're really excited. But that's what they do, is they're more of a holistic sort. And I know there's other ones like Montessori has that as well.
actually,
yeah,
if Montessori and Waldorf got married, they would have revolutionized the world. One is left brain, one is right brain.
It's true. But yeah, looking at it from a holistic perspective as well. So tell us that story. We were talking with somebody earlier. I was talking with one of our producers earlier. So coping. I got to pick your brain on this. We're here at the WINA studio, and hammers are banging. I guess they're expanding, and they're remodeling, and you and I were out there just kind of trying to carry on a conversation. I was almost chuckling because I was looking at you. Your lips were moving, but I couldn't hear anything with all the noise. So Ann walks in, and she's like, "Oh, it's driving me crazy." And so she had this whole coping mechanism. So how would you help somebody like Ann in a situation like this? Or what do you mean? You had said, well, see, that's one of those things. That's one of those coping mechanisms that you have.
So what we have learned to do is that, again, our ability to be able to be in situations, what we've done is we haven't created prevention strategies, we created after the fact. So what do? We shut down, we run away, whatever it is that we do. So Well, I'll give you an example. I had an
Please.
autistic little boy who screamed for 10 years.
Mm-hmm.
And that was his way. That was his way to cope with meltdown. He was
Okay.
melting down because he was frustrated with school, frustrated with the things that were going on. He couldn't communicate verbally his feelings,
Okay.
so he would scream.
That was his coping mechanism.
Exactly.
That's
And
just
what
go-to.
what it did is it created all kinds of issues for the rest of, the rest of the family was suffering from PTSD.
Yeah.
So after 10 years of this, and what I had to do is redirect that, first that behavior, and then teach him what to do when he had meltdowns. So
Okay.
I removed him from the situation. I demonstrated to him, every time you do this, you can't be social. So he would be removed into a different place by
Okay.
himself,
Yeah.
and then I would whisper to him so low that he had to stop screaming in order to be able to hear me.
Mm-hmm.
And after that, after he finally got it out, it takes about 30 days to change a behavior.
Yeah.
After he stopped, by the time you got lifting him up and pulling him out day 29, he got almost immediately stopped screaming. But then we had to talk about, what do you do when
Yeah.
these things happen? You can't, you don't understand the person, you can't communicate. What would you like to do in that situation? And he figured out for himself to go for a walk.
Okay.
So every time he gets frustrated, every time he's dealing with something where he cannot communicate,
Yeah.
instead of screaming, he picks himself up and he goes for a walk, calms himself down, and comes back in.
Okay.
Then he is able to communicate, and I give him the vocabulary and the way to talk, to be able to communicate with
Right.
people. Now talk about your feelings now that you're calmed down.
Okay.
The same thing holds true for this situation
That's
here.
what I want to know. Yeah. So, because I have certain situations like that too, and who is dealing with remodeling here. So, preventatively speaking, you mentioned that.
So
So would
preventatively,
she
she can
have-
wear earphones.
Okay.
You know, she can wear the muffles in
Yeah.
order to be able to not to hear that noise.
Get some white noise.
Get white.
Yeah.
That was my second thing,
Okay.
to get white noise. And the third is to remove your. Do you have to be in this environment all the time? Go out. I mean, it's beautiful outside. Go
Yeah.
outside and work.
Take a laptop
She,
outside.
well, she just said they all had
Yeah.
laptops that they
Yeah,
were working
right.
with. So take the
Oh,
laptop and go
okay.
sit outside. There's benches out there.
Mhm.
So that's the problem. We don't
Mhm.
think outside the box in
Yeah.
situations. We
Yeah.
we react rather than
Yeah.
respond.
Yeah.
And so there are all kinds of alternatives, but we have to step outside the box to think creatively in terms of doing that.
So help me and help our listeners to think outside of the box, Dr. Daria. So people who are listening right now, maybe they have their own frustrations or irritations or whatever, and just maybe generically painting broad strokes
Oh,
here.
that's not one. There's no one size fits all here.
Is it for instance, breathe,
Exactly.
stop? I mean, there's got to be some strategy.
Somebody told me the other day,
Mhm.
fear is holding your breath.
Okay.
And I think that's a really great example of not knowing how to. I mean, we all hold our, when we're afraid, we go.
Yeah. Yeah.
And so,
True.
breathing.
Okay.
That's a perfect example.
Mhm.
Closing your eyes. As a matter of fact, I was sitting in there a half hour before you arrived with all
Yeah.
the banging, and I sat in there and I closed my eyes,
Okay.
and I just relaxed my body and kind of tuned out all the noise. That's another way of doing things.
Okay.
You know, physical kinds of movement will always help you in a stressful situation, whether it's to go out for a walk, remove
Yeah.
yourself from the situation, whatever it is. It will, once you remove yourself from that situation, it will help you a lot better. Also, surrounding yourself with people who are supportive.
That's true.
A lot of times there are people in our lives who are not supportive of us, and it's
Mhm.
really important to have that in your life,
Yeah.
having people who will assist you in those times.
A couple things that I've found to be really helpful is to train for the event before the event occurs. So I've mentioned this before, but I'm a triathlete. I love training. I love doing the races, but there's no way I would show up for a triathlon having not swam, run, and biked and trained for this event. Knowing that it's coming up, I train for it, and then when the event comes, it's still hard, but I've already prepped for it. In these real life scenarios, hey everybody, stress is there. This is our world. Stress will come. So why not train for it.
Exactly.
And some of the things that I found to be super helpful for myself is breathing, is resting. I love the 10-minute power nap each and every day, getting my brain ready for it. I like to meditate. Yoga all seems to really help out.
Sleep
Yeah.
and eat properly.
Yeah.
Those are two
So those things are helping to prep the brain for the oncoming stress. Everybody's going to have stress. In my practice, Chronic Care Charlottesville, we deal with a lot of senior citizens. And those of us who are still working oftentimes mistakenly think that, oh, life's going to be better when I don't have to work because there's going to be no stress. And for those of you who are listening who are retired, know that is not a reality. You're never going to, until you die, you're never going to be able to outrun stress. It's always going to be there. So planning for it, training for it like I do for a triathlon, preparing for it so that when the hammers come, you can go to that place because you've already been training for
Exactly, and we don't learn those skills from our parents generally, and so we have to really develop those and figure out ways for ourselves. And there is no one size fits all for it. Everybody has their whatever you gravitate to is the best way for you to be able to find those outlets, to be able and develop those skills. Those are prevention skills, and those are the kinds of skills we need to be developing.
I
at
agree
any
with that.
age.
Yeah, I totally agree with that. Well, here we are at the end of the show, Dr. Daria. I know there's people on here that are going to be dying to get a hold of you or to learn more information. How can they find you?
You can go to www.docdaria.com, or you can email me at daria@docdarb.com, or you can call 434-286-2989. That's www.docdaria.com or Daria, Daria, at docdarb.com.
And give us your number. It's a little slower.
434
There we go.
286-2989.
It's been great having you on here, Dr. Daria.
Thank you so much for having me.
All right, we'll talk soon. Like next week. So if we do another one, good job. If we do another one and it's 2:30, we could do another one.
Okay.
What
I'm
I'm
not
gonna
meeting
do
your
is
daughter
I'll-
till 3:30. I'm not meeting your daughter till 3:30.
Okay. Yeah, well, we have to be out of here by 3 o'clock.
Okay.
We have a time limit. So if we do another one, why is it doing that? Oh, it's hearing my voice. Okay, I have it on pause. So if we do another one, I'll hit pause again. We'll let it run for 5 seconds, and then that way Mark can see the split right there. And then I'll say, hey, we got an opportunity to I got Dr. Daria back in the studio again.
We'll talk
so
about
that's where
autism
we're at.
this time. Yeah.
And you want to talk about autism this time?
Yeah,
Okay.
we can do that. I will talk about how any profession is not dealing with autism.
Okay. And do you happen to know the rates of autism and how fast it's
Rates?
growing? How
Yeah.
many people have it?
Yep.
And the
1 in
and-
68.
Yeah, 1 in 68. And what's
But
the
for
prediction?
for boys, it's 1 in 42.
Yeah. And the prediction, I can't remember if it's by the year 2030 or
1 in
2050.
32.
Yeah. And I've heard even scarier amounts, like by 2050. And I don't want to quote the wrong thing, but by 2050, it's something like 1 in 10 or something. Do you know that?
Not that part. I don't. That
All right.
fast. I don't know.
All right. So then I won't put you on the spot there, but let's talk autism. Let's talk about how this is a real problem. And then obviously we have to
I
go
can
into
do
causes
why
and
we
treatments.
have it.
Yeah, I wanna
why
know
we
that.
have it. There's a lot of reasons why we have it.
Mhm.
So, and it's all health related,
Okay.
in my estimation. And this
Yeah.
is my book. So,
Okay. And do you find a correlation with vaccination?
vaccination, birthing practices,
All right.
environmental issues.
Yeah,
It's
good,
that's why
good.
it's a spectrum.
I want to talk about that for sure. I
Okay.
just didn't want to bring that up and make you go,
No.
okay. So, yeah, because I'll probably bring that up. I'll say something like, look, I know there's a question mark on there about vaccines, preservatives, and all the stuff in our food.
I
Talk
really
us
want to
about
get to
that.
birthing practices, though. That's one of the major
Okay.
issues why it
Good,
happens.
Good. So, you'll have to talk mostly on this one, but
Okay.
what I'll do is I'll hear stuff, and I usually like to do that. Wait, I want to backtrack a
That's
little
fine,
bit. You
that's
said
fine.
this. Can you expound a
That's
little bit
fine.
more on that? Okay.
You gonna start over again, or?
Yeah, I have to start all over again.
No, I meant to zero,
Yeah,
or
I'm
do
gonna
you-
hit. No, oh right, yeah, we're at 22, so we're gonna finish at about 44.
Oh, go.
Yeah.
Okay.
Yeah, so we got plenty of material there, right? I'm just gonna hit it and just get started. Well, good morning to you today. Good morning. This is Vitality Now, and I am so excited. We actually got Dr. Daria Brezinski back in our studio again. And if you missed the show last week, make sure you go on to wina.com and check out the podcast where we spoke last week on holistic healthcare. So, Dr. Daria, thanks for coming back.
Oh, thank you so much for having me.
This is a super volatile, super, I'm thinking exciting, but it's not exciting, a scary subject that we're talking about today. But let me introduce you for those who are just joining. We're with Dr. Brezinski, who has degrees in education and psychology, been working 30 plus years with people with autism, children and adults, and other can we call it psychological issues, and helping people to overcome their coping and their dependencies, and helping to lead less coping and more holistic and better lives, right?
Those who are missing skills, remember?
Missing skills.
Yes,
Okay.
the soft skills.
So let's talk about our topic of today, autism.
Okay.
Tell me, start us out. What is autism? Where does it come from? What's the big deal? Talk to me about autism.
Well, there is so much controversy over autism, but since I work with people all the time, I feel like I have a bit of a grasp on it. And people constantly ask where it comes from. And, I don't have specific studies, and everybody is constantly controversial about where it comes from.
Mm-hmm.
But in my opinion,
Yes.
I think it's a spectrum because it comes from a variety of things that we have done and created in our world. First of all, our birthing practices. We no longer have natural births. We, for the most part, have C-sections with women. And there was a study done at the National Institute of Health many years ago, and it was published in JAMA. And it demonstrated how
JAMA is the Journal of American Medical Association.
And what it said was
AMA.
that when you're in utero,
Mhm.
you have twice the amount of neurons that you need, because as you pass through the birth canal,
Yes.
so your head is squeezed, and so those fall away.
Mhm.
What happens when you have a C-section is that they all remain. And what happens is it makes you hypersensitive and sensitive and hyper-focused with listening to all kinds of sounds, being able to hear things that most people don't hear, and probably the inability to focus.
In the field of neurology, we call that neurological pruning. It's kind of like pruning
Yes,
the rose bush. You're ended
exactly.
up with all these brambles all over the place, and then
Exactly.
you come in like an artist, and the body or the brain or the body is will actually clip and prune to the exact needs of the body. But what you're saying is that NIH found that pruning, that clipping process doesn't happen with a C-section, and so little babies are coming out hypersensitive, meaning they're having way too wired.
Yes.
Okay.
And
Wow.
that's only part
What's
of
the
the birth.
what's the rate of C-section? Is it 1 in 3 now?
It's astronomical.
It's
Absolute
1 out of 3
astronomical.
or
Yes,
more
Yes.
across the nation.
Yes.
So I got to rewind too. I just have to say, my wife and I were both crazy chiropractors, but we're rare. But all 4 of our kids were born at home.
I'm aware of that.
Yeah.
Well, the second
Yeah.
thing is that we give children, we don't nurse them, and so they don't get the kinds of immunities they get when they should be nursing, at least for the first year of life.
I agree.
And we
Yep.
give them bottles with
Mhm.
formula in it that are full of sugar. Then we make them addicted to sugars. We give them plastic to put in their mouths, whether it's a binky or a bottle. And
Right.
we know plastic have PCBs, so if you make it cold or hot, those PCBs are emitted.
PCB,
So now
bad stuff.
we're now talking about we've gone to environmental issues. And when we created in the 1970s, when we created corn syrup. So now we have a pile of corn one of the professors over at UVA did a hair study. First he studied mummies' hair, and he found that they had largely a vegetarian kind of diet from the Egyptian mummies. And so he decided to study hair over time,
Wow.
including his students over at the university.
Wow.
And what he discovered was, as soon as the 1970s happened with the corn, we went from our hair being healthy from vegetables and the agrarian lifestyle we
Yeah.
had to full of corn. And so we have all these diabetes problems now, and people having excess of sugar.
And we could do a whole show on this, but the federal government subsidizes farmers to grow wheat and corn and all these other grains, and farmers are paid for it even though we really don't need it. And like you said, we have piles and piles and silos of all this extra corn, and the federal government's like, what are we going to do with all this? So they go to the chemical magicians, the chemists, and say, figure out what we're going to do with this stuff. So then they create corn syrup, high fructose corn syrup. They actually, this is going to kill you, but they actually the lobbyists for the corn industry has just lobbied Congress and allowed them to change the name from high fructose corn syrup, because they altered it just enough to where they said, look, it's different than high fructose corn syrup. It really is that. But they're now able to call it natural sweeteners.
Yes, exactly.
So let's not mention any companies, but on some of the packaged foods that you get, they can now actually print on there no high fructose corn syrup, because now everybody knows that stuff is bad. They're sneaking it in.
Okay,
But let's get back to autism.
So what where I was trying to get to is so we are on prescription drugs. People are on 2,